When we talk about epilepsy, epilepsy is known as upsmart in Ayurveda. In modern science also, there are various kind of treatments that are today laid down for epilepsy patients. In many of the patients, the patient is guided to take medication for up to 3 years. We won't criticize the Ayurvedic treatments of epilepsy because many people benefit from those treatments also. But then, there are a number of patients who, despite taking the treatment, are unable to come out of this disease. Ayurveda is a very good alternative for all such patients. In Ayurveda, epilepsy is termed as upsamar. As per the doshic differentiation in Ayurveda, there are various kinds of epilepsy that has been categorized. Here, we won't go into the details of various kinds of epilepsy, but there is something very common when it comes to the treatment of all such patients. When we talk about the treatment of epilepsy patients, it's basically the coordination of a right and left brain that is improved with the help of Ayurvedic herbs, minerals, and in some extreme cases, Ayurvedic metallic preparations. When these medications are given to the patient, the spikes which are otherwise very much evident in the EEG are significantly reduced in majority of the patients even after the first month usage of the medications. Many of anti-epileptic medications are prepared in cow's ghee, that is, they are ghee-based medications. While there are other medications which are categorized in Ayurveda as Akshep Shaman medications. Akshep Shaman medications are one category of medications, that is, if we properly translate it in allopathy, we can say those medications which are anticonvulsant. Apart from these anticonvulsant medications, the Sandhyastapan work of Ayurveda, the Medhya Rasayan work of Ayurveda are very good for epilepsy patients. When these medications are given to the patient in a proper dosage for a specified time period, the patient is able to come out of this disease in a very nice way. Whenever the treatment is started, both the severity as well as the frequency of seizures very quickly reduces in the patient, even if the patient is having regular seizures. And if the patient is having intermittent seizures, then in many of such cases, there is not even a single episode of seizure after the start of medications. If we talk about Medhya Rasayan, that is the core prime medication mentioned by Acharya Charak. In Charak Samhita, for such patient, there is a very nice shlok that is given in Charak Samhita, Manduk Panya Svasya Prajya, Shiren Yashti Mudukasya Churnam, Raso Galuchyastu, Sa Mul Fal Pushpa Khalu Shak Pushpya. It means that Mandupani, the swaras, which you can say extract of Mandupani can be used. Shiren Yashti Mudukasya Churnam, Yashti Madhu is Muleti, that is the usage of Yashti Madhu, Muleti children with milk. Raso Galuchyastu, that is the swaras of Niloe, that is Tinospora cardifolia, and Sa Mul Fal Pushpa Khalu Shak Pushpya, that is the Pancham, all the parts of Shak Pushpa. These all are very good Medhya Rasayan. They are very good for brain, for improving the coordination of left and right brain. And when these are given to the patient in a specified dosage with Akshep Shaman medications, the results are really miraculous. The best part of Ayurvedic treatment in epilepsy is that it can be given alone, and it can also be given along with the normal therapy that is being given in allopathy for epilepsy patients, like carbamazepine, sodium valproate. Any kind of medication is being given to the patient. These Ayurvedic medications are not having any kind of drug interaction with those medicines, so they can be given along with those medicines also. So that is the basic concept of how we can treat epilepsy patients with the help of Ayurveda.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma.